According to the World Health Organization report of 2020, 41 million people every year die of non-communicable diseases globally. 2/3 of these deaths are from low and middle-income countries. However, these account for 1 in 3 deaths in Uganda, majorly from diabetes, cardiovascular diseases, chronic respiratory disorders, mental illnesses, and injuries from accidents. In this documentary, Rose Academy's Uganda presents a sneak peek of this crisis through talking to the health experts and the affected communities.
About the non-communicable diseases, yes, they are a reality. We see a number of them here, majorly diabetes mellitus, both type 1 and type 2. We have hypertension, heart failure, and of course when they get complicated, they can worsen, where you get chronic kidney disease arising in a patient who has been having diabetes for a long time. Yes, so they are common in this area, not just among the old people the way it used to be, but even the young. You find that a big number of young people are becoming obese. They are taking a lot of alcohol and smoking, and they are predisposed to these cardiovascular diseases.
Of course, non-communicable diseases are mainly dependent on our behavioral mechanisms, more so in terms of unhealthy dieting, body inactivity, less of physical exercise, sedentary lifestyle whereby most of the time someone is seated and maybe they are eating more than what they are burning. The other one could be the substance use and smoking could also leave them. Then you have the poor health seeking behavior of people going to test and know their status as regards to the non-communicable diseases. The other one could also be psychosocial stress and the genetic factors.
Over the years, non-communicable diseases have been given less attention by members of the community, but this has even worsened due to the COVID-19 pandemic.
Currently, we have COVID-19. However, this found us with other non-communicable diseases like cancer, HIV, and high blood pressure, which are given less attention. Personally, I'm a high blood pressure patient. This I found out after having difficulty in breathing, and I went for testing in hospital. So I was advised to improve on my diet, exercise more, and take medication seriously.
Not only do NCDs pose psychological effects, but they are also the leading drivers of morbidity, mortality, and disability globally.
When one gets sick, the caretaker really gets worried. It affects your mental state, and this is really sad because that's how I feel. Sickness affects one's work because 1 minute someone is working and the next they are down. Men don't take diseases serious until something physical happens, and everything worsens right now. The feet is swollen, of which this would have been prevented if my patient spoke earlier.
The Uganda Non-Communicable Diseases Alliance report of 2020 reveals that 31% of Ugandans die from non-communicable diseases due to ignorance.
Those diseases are mainly for the aged and rich people, so I don't think I can fall a victim. I would love to go for a medical checkup, but I cannot afford the medical bills. Free medical checkups would be put in place to cater for us in the poor communities.
obusobozi bwagenda zikebeza ezo endwadde pressure mungi mu bantu lwakuba
High blood pressure is too much in our community. Though you cannot spot people, but we have a community clinic which we all use and also make use of our own herbal medicine. None of us know where help comes from because we already see people on TV crying to government for help, but then government cannot help everyone. So we just have to try our own. Actually, even now as you found me, I'm going to drink my herbal leaves because I don't feel fine at all.
kati awo ne tusoberwa tulina kulemerako n'essaawa eno nsanze nva kuleeta kaluluuza kano.
Programu ezisinga tuteranyazuuliza kuba nze ntera okulaba ku TV. Naye programu ezisinga nzuuliza ku TV. Kuba no mu byalo kizibu batono nnyo abayita nti bagenda babulira house to house. Naye kati nga omanyi tonda omulwadde. Bw'onogezaako owulira programu nga ku radio TV babuulira. Kati naye n'ogezaako okukola ki? Olaba nti ofaayo nnyo okuwuliza programu eyo bagamba basomesa ki? Bakola batya naye nga media tubiruza mu TV na radio.
Non-communicable diseases are predicted to become the leading cause of deaths in the region by 2030 if action is not taken.
Well, I would want people to know that non-communicable diseases are increasing, especially among the urban poor. The urban poor, they are exposed to, they eat fast foods, they use drugs, they eat a lot of salty foods which will increase your blood sugar. So being in the urban setting actually puts you at risk. So you need to actually be very vigilant in trying to have a good diet and having health checkups done. Testing is not the issue, but the number of people who will actually avail themselves to the hospital so that they are checked, that is where the gap is.
Daily to be sufficient for someone by doing light exercise like walking, cycling, those in the rural areas, they can even do digging, that is at least for 30 minutes. When it comes to the children, we recommend, at least the WHO recommends 1 hour would be sufficient for the children.